All right, this is a quick review of the muscular system. I'm creating this tape at home, so I apologize for interruptions before they start, because guaranteed they're going to happen. Anyway, so we're starting with the muscles of the head, and this is in table 10.1 of your textbook. We have the orbicularis oculi as the round muscle around the eye. And then we have the orbicularis oris, which is around the mouth. So this muscle closes the eye, and this muscle closes the mouth. Then we have the muscle over the cheek, which is the zygomaticus muscle. There's a number of muscles that make up this particular muscle, so this whole group here is the zygomaticus muscles. So that we have the major and the minor here. So the zygomaticus muscles. Then we have the masseter, which is a wide, thicker muscle right in front of the ear. It allows us to chew or close the jaw. So that is the masseter muscle, and you can feel that. If you clench your teeth together, you can feel that bulge out right in front of your ear. And the zygomaticus muscle is for smiling. It allows you to smile. And then moving down into the muscle of the neck, we have the sternocleidomastoid muscles on either side. They attach at the back of the occipital bone to the clavicle and the sternum. So they get the name sterno because of the sternum, cleido for the clavicle, and mastoid, which is the mastoid bone, part of the temporal bone. So it's the sternocleidomastoid muscle, both of these muscles here. And if we flex them both, we bring the chin to our chest. If we flex one of them, then we are rotating the head. So those are the functions of those muscles. Then we have the deltoid muscle over the shoulder. It's a triangular muscle and allows you to abduct the arm or to move the arm away from the midline. That's the deltoid muscle. It's a triangular muscle. That's where it gets its name deltoid, because it's like the Greek letter delta, which is a triangle. So it's wide here and pointed at the bottom, the deltoid muscle. And then across the chest, we have the pectoralis major muscle on either side. It's peeled away on this side, but this is the pectoralis major, and that allows us to flex the arm at the shoulder, so it brings the arm inward in an adduction motion, ADD, adduction, bringing the arms together in the front of the body. That's the pectoralis major muscles. And then we see these muscles between the ribs. These are the external intercostal muscles, so they're important for breathing. They allow us to inhale or to increase the rib cage, elevate the rib cage, external intercostals. Then moving down, looking at the back side of the body, we have the trapezius muscle. It's a diamond-shaped muscle that comes off the back of the head, over to the shoulder, and down to the middle of the back. And it's on both sides. It's been peeled away on this side. But this is the trapezius muscle. It's a diamond-shaped muscle on the back of the body. And then we have the deltoid again, that triangular muscle over the shoulder. And the trapezius muscle allows you to shrug your shoulders. So when you rub someone's shoulders, that's part of the trapezius muscles you're rubbing. And again, the action is to shrug the shoulders or raise the shoulders. Then we have the Latissimus Dorsi. It's a large, thin, sheet-like muscle on the sides of the back and attaches to the back here, you can see. And this is, again, the Latissimus Dorsi. It's on both sides of the back. It's been peeled away on this side, but here we can see the Latissimus Dorsi. And it allows us to bring the arm out and backward toward the body. So we call that the power stroke motion. That's the function or the action of the Latissimus Dorsi muscle. And then at the bottom here we have the gluteus maximus muscles, the large muscles of the buttocks, and that allows us to extend the leg at the hip. So to bring your leg backwards is the gluteus maximus, and above that are the two gluteus medius muscles. So this is the gluteus medius above the gluteus maximus. And then we come around to the front of the torso. We have the abdominal muscles. The most superficial muscle are the external obliques. They're on the sides here. They come down at an angle. External obliques, and allows us to compress the abdomen. And then we have the rectus abdominus muscles that are in the center of the abdomen. The fibers run up and down. This is what we call the six-pack. When you see those bulges there, that's the six-pack. But again, this is the rectus abdominus muscles over the abdomen and running straight up and down, rectus abdominus. If we peel away the external obliques, we'll see another sheet of muscle over the abdomen with the fibers running in an opposite direction from the external obliques, and these are the internal obliques. Again, they're running at an angle here, but at a different angle than we see the external obliques. And then if we peel away the internal obliques, we get the transverse abdominus. These muscles run transverse or sideways over the abdomen. So this is the most deep of the abdominal muscles. So you have the rectus abdominus, external obliques, internal obliques, and transversus abdominis. All of these together flex the vertebral column or compress the abdomen, which is the motion you would make in performing a sit-up. And this sheet of white here is again another example of epimysium, which is the outer covering of muscle, and this is in a sheet-like arrangement. So epimysium that's in a sheet-like arrangement, we call that an aponeurosis. So we see an aponeurosis here over the head. That's an aponeurosis. Here's a little bit of aponeurosis. Well, that might be bone, but this is aponeurosis. It's just a covering over muscle that's in a sheet-like arrangement. So now we look at the muscles of the arm. Again, here's the deltoid over the shoulder, and then we have the muscle at the top of the arm, which is the biceps. So this is the biceps. This is the muscle that we can develop when we do arm curls. This allows us to flex the arm at the elbow. And then underneath that is the triceps. So on the back side of the arm is the triceps muscle. But again, you have to have the second name for each of these muscles. So it's biceps brachii and triceps brachii. So biceps brachii on the top, triceps brachii behind on the back of the arm. And between the two muscles here, we can see it on this one pretty well. So we have the, here we can see we've got the biceps brachii here, triceps, and between the two is the brachialis muscle. So the brachialis muscle lies between the biceps and the triceps if you're looking at a side view of these arm muscles. And then the muscles over the forearm on the top of the hand, these are the extensors of the wrist and hand. As long as you're looking at the top side, it's just called collectively the extensors of the wrist and hand. And if you're looking at the palm side of the arm, these are the flexors of the wrist and hand. This whole group of muscles here, flexors of the wrist and hand. And then we move down into the legs. So here we can see the front of the leg. Here's the knee. So these are the quadricep muscles across the front of the leg, and these muscles allow you to extend the leg at the knee or to make a kicking motion. So down the middle we have the rectus femoris. Femoris, it's over the femur bone, so that's where it gets its name. Rectus, it's straight up and down over the femur, so this is the rectus femoris. And then on the inside of the leg we have the vastus medialis, and on the other side of this muscle we have the vastus lateralis. So you have the rectus femoris in the middle, then you have the vastus medialis and the vastus lateralis. So if you look here at the knee, you can see the three muscles of the quadriceps. The fourth muscle you don't have to know, but the three muscles that you do have to know can be oriented at the knee. So straight in the middle is the rectus femoris, on either side vastus medialis, vastus lateralis. And then we have this long muscle which allows you to rotate the hip, as in when you cross your legs. This is the Sartorius muscle. It starts on the outside of the hip and travels to and connects to the inside of the knee. It's the longest muscle in the body. It's the Sartorius. Here's another view of the Sartorius muscle coming down here on the inside of the knee. So that's the Sartorius muscle. And then looking at the outside of the leg, this is a view of the outside of the leg. We have this muscle here at the top with a lot of fascia, a lot of connective tissue. This is the tensor fasciata. So the tensor fasciata allows you to abduct the leg, which means to move the leg away from the midline, as in a jumping jack. So the tensor fasciata, there's a lot of fascia or connective tissue on it, and that's where it gets its name, the tensor fasciata. Some of you may know of this as the IT band. That's what this connective tissue is here, but the muscle at the top is the tensor fasciata. And then if we turn around and look at the inside of the leg, opposite the tensor fasciata, on the inside of the leg is the gracilis. So this is the gracilis muscle here, running down the inside of the leg. And this helps us to adduct the leg, or to bring the legs together when you're completing a jumping jack. So that's the gracilis muscle. And then if we look at the back of the leg is, there's three muscles you need to know. There's one large tendon that attaches to the outside of the knee, and that is the Biceps femoris muscle and its tendon that attaches to the outside of the knee. So you've got the Biceps femoris. And then the other two muscles, one is on top of the other. The one on top here is the semitendinosus. So that's the semitendinosus on top of the semimembranosus. You can see a wider, flatter muscle underneath. That's the semimembranosus. So if you feel the inside of your knee, you'll feel there's two tendons that attach there. The tendinosus is the thicker tendon that you feel on the inside of your knee, and the semimembranosus, its tendon, is the weaker, thinner tendon that you feel on the inside of your knee. So that is, again, the semitendinosus on top of the wider semimembranosus, and the Biceps femoris on the back of the leg. Again, it's over the femur, so that's where it gets the femoris name, Biceps femoris. And it's on the back of the leg, so just remember, B for back, Biceps femoris. And these muscles work to flex the knee, flex the leg at the knee. So when you kick your leg backwards, you're working these muscles. We call this group of muscles the hamstrings. Because of those tendons, those long tendons that attach at the knee, this is the part of the pig that makes up the ham, and butchers would hang the ham in the butcher shop by these tendons. So that's where they got their name, the hamstrings. And then looking at the back side, there's another muscle you need to know. Again, if we're looking at the gracilis here, and that's what this muscle is, the gracilis, just above that is the Adductor Magnus muscle. So if we're looking on the back side of the leg, we have the Adductor Magnus muscle that's visible on that side of the leg. So this is a muscle, again, that helps us to adduct the leg, so it's pretty easy to remember that. And then if I look at the front side of the leg, which is here, it's kind of hard to see, but if I look at the sartorius coming down here, just in front of the biceps, the rectus femoris, just on the other side of that is the adductor longus. So the adductor longus is on the other side of the sartorius. So the sartorius kind of divides the rectus femoris from the adductor longus. So we have rectus femoris, sartorius, and adductor longus. So the longus is seen on the front side of the upper leg near the hip, and the adductor magnus is on the back side of the leg near the hip. And you can use the sartorius as kind of a dividing line there to find those muscles. Looking at the back side of the lower leg, then, we have the calf muscle, which is the gastrocnemius. The gastrocnemius is the large calf muscle, and it allows you to point your toe. We call that plantar flexion, when you point your toe. Underneath the gastrocnemius is another muscle here. It's underneath. It's the soleus muscle. It's kind of hard to see. It's actually this thin muscle underneath the Achilles tendon of the gastrocnemius. That thin muscle, that's the soleus muscle. That also allows you to plantar flex, or to point your toes. On the front side of the leg, we have the tibialis anterior. The tibialis anterior allows you to bring your toe to your nose as in dorsiflexion. We call that motion where you're bringing your toes upward as when you're walking on your heels. That is dorsiflexion. So that's the tibialis anterior. One other muscle that I didn't mention, and that is the iliopsoas muscle. At the top of the, let's see if we can find at the top of the sartorius, we have this muscle, just where it attaches on the inside of the thigh. I think maybe our torso model might show that. No, it doesn't. Well, the iliopsoas muscle is kind of hard to see here, but it's just inside the sartorius muscle here. So this would be the iliopsoas muscle. It's actually a group of muscles, kind of hard to see in this particular model. I would probably just refer you to look at your textbook. Table 10.14, 1014 shows a nice picture of the iliopsoas muscle. That's one muscle that isn't shown well on these model pictures. So I recommend that you print these off, print multiple copies. You can make a nice set of flashcards. Don't forget to remember the actions of each muscle. They will be in multiple choice format, the actions will be, but getting down these names and spelling is an important skill. So do make sure you spend the time in getting that accomplished. And that completes this video.